to give our dietitian a call. Damien, your camera is on. Would you mind turning that off?
Right.
And then Moira, what we'll do is we'll try and get you sorted in relation to the steps you need to take in relation to that. So Moira, don't hesitate to drop us a line here, and Sarah, the dietitian, will be in touch just to help you along the way there, okay? So Alfonso, you're back on there with us.
Yes, I'm back. Sorry, I just needed to set another computer. Looks that's something wrong with it.
There we go. There we go. All right. Well, everybody, this is Dr. Alfonso Rodriguez Herrera joining us again for Coeliac Awareness Week in 2023. Alfonso has been a great supporter of the Society over the last couple of years and is actually sitting on our clinical advisory and research group as well. Has a lot of experience and background in celiac disease, in particular in pediatric celiac disease. And he is going to talk to you today about getting diagnosed and I suppose the long road to diagnosis with celiac disease. Just to remind everybody, this webinar is being recorded, so you can listen back to it, and it is sponsored by Promise Gluten Free, who are sponsoring everything this week with Coeliac Awareness Week 2023. And we are delighted to finally have Alfonso on board and ready to rock and roll. So Alfonso, take it away. Thanks a million.
Okay, thank you for having me here today, and my apologies about the delay because I'm having a technical issue. Unfortunately, I'm not going to be able to share my slides, so it would be in the old-fashioned way to use my voice. So basically, what I would like to discuss with everybody is the diagnosis. My main expertise is in the pediatric field, but I am also involved in the groups working with adults. If at any say, by the way, you cannot listen to me, please raise your hand in the system because can be some technical issues. So today in 2023, the diagnosis is slightly different depending where you are in the world. Also, it's slightly different depending if you are a child or you are an adult. What is equal for everybody is the fact that to be diagnosed of celiac disease, the first step is to get somebody to think about that. Symptoms can be quite different. In the old days, the main way to diagnose is a child with diarrhea and malnutrition. But that's gone now. So many people now with the diagnosed celiac disease don't have diarrhea and they don't have any gastrointestinal symptoms. For example, people can present with anemia. People can present with osteoporosis, that is becoming the most common presentation in adult population. Or people can be presenting the depression or behavioral issues that was not considered a symptom in the past. Somebody think about the celiac disease. The next step will be get a blood test. Everything start with a blood test. It's not difficult, and there are some ready-to-use kits that can be used for a screening where you only need a drop of blood taken for your finger. And basically, what that blood test is looking for is for antibodies. It's a category of antibodies called anti-transglutaminase. When somebody is celiac and gets exposed to gluten, the gluten will cross the intestinal barrier and will interact with the lymphocytes there, creating inflammation. That inflammation will trigger the creation of these antibodies that we call anti-transglutaminase and a second class called anti-endomysium. That will be the usual response in celiac people. But, and that's very common in children, if you have an immune deficit called immunoglobulin IgA deficit, which is very common, and to most of the people only is going to create some easy to get easily colds and viral infections, but it's not going to create other symptoms. If you have this IgA deficit, your anti-transglutaminase test can be a false negative. So that's why it's the most convenient practice to get checked at the same time you get the anti-transglutaminase or TTG test and IgA test to be sure you don't have that deficit. If that test becomes positive, that shows that you have an inflammation, the next step will be different depending, as I mentioned, where you are. If you are a child and your tranglutaminase is more than 10 times over the normal value, your doctor will request a second test. So another TTG will be done, as well as anti-endomysian. The anti-endomysian acts as a quality control to be sure you don't have false positive in this case. If this second test comes again more than 10 times over the normal range, in Europe, you can be considered as a celiac. In the American, United States, they still go for a biopsy. Today, you are an adult, if you get this positive value, you will go for a biopsy. A biopsy is something done with a scope, a tube and a camera that goes through the mouth and crossing the esophagus and the stomach, go to the small bowel, where several samples will be taken. It's recommended to take at least 3 to 4 in the distal duodenum and 1 to 3 in the proximal duodenum. They are supposed to be what's called villi. So this is like they are like little fingers where the absorption of the food happens. When you are celiac, because the inflammation, all these villi are going to be gone. So we'll have what is called a flat mucosa, where you cannot see that absorption element. If that biopsy confirms there is a malabsorption and inflammation, you can be diagnosed as celiac. Now, in 2023, in January, the guidelines in the United States have been reviewed, and they are starting to consider that in this particular cases of adults with a high level of inflammation, high level of anti-tranglutaminase, if they cannot get access to the biopsy, the diagnosis can be done in the same fashion that is done in Europe in children, just having 2 samples of high antibody level, more than 10 times over the cutoff. In that cases, they may consider celiac without a scope. It's not considered the regular or the most common practice, but it's now in exceptional cases going to be done. The most important condition for the biopsy is to be on gluten diet. It's very difficult to get a diagnosis if you go off gluten, and then will change the finding in the mucosa and can create a lot of confusion. So to be accurate, everybody undergoing a biopsy should be on gluten. After the biopsy is reported, it is atrophy. So the flat mucosa, the lack of villi is confirmed, then will be the right time to start the gluten-free diet. That should be supervised by a dietitian. So there's a huge difference in the countries through Europe and America that can access a dietitian, and other countries where the dietitian are not available. So the long-term compliance and the quality of life is really, really different. So to summarize, the journey of somebody going through the process of being diagnosed with celiac disease will be, think about celiac disease because the symptoms I have, ask for an appointment with my GP, get the blood test done when you are on normal gluten-containing diet. If the blood test suggests that you may be celiac because there are high level of TTG or anti-tranglutaminase, get a biopsy if you're an adult. Get a biopsy if you are a child but your levels are not too high, or confirm the diagnosis with a second blood sample if your levels are very high and you're a child. And after getting the diagnosis confirmed, get advice from a dietitian to get the proper training about how to go into the gluten-free diet and have your follow-up organized. Basically, this is the road of the journey of the diagnosis of celiac disease today in 2023. I don't know if anybody around. I will be open to any questions or any discussion. Well, I have seen here a question from Kathy. That situation is not so strange, and the experience is when somebody is not diagnosed in childhood, becomes really, really difficult to be diagnosed. Remember that many doctors have been trained to think that celiac disease is a matter of childhood and diarrhea, but you're an adult and your only symptom is anemia or osteoporosis or tiredness. It's going to be difficult to be diagnosed. So another thing that happened is people we usually enjoy a very good quality of life. So many people also are not feeling great. They're going to get medical attention and they will compensate their symptoms. Another question for Amanda. Muscle twitching can be a presenting complaint? Can be. And actually, I recently have a teenager who came to the clinic with that complaint. It's not the most common presentation, but it's possible. What that happened? Because celiac disease is a systemic disease. What is a systemic disease? Any part of your body can be more or less affected. So some people get an involvement of their neurons and they can be having twitching or tremors on the hands, on the legs. And many of the people with what's called neuroceliac disease do not have diarrhea or do not have constipation. Sabina asked about a case of celiac disease in the family, and the other siblings have been tested, what is actually recommended. If they're negative and they're asymptomatic, the current practice is to retest if they are symptomatic again, um, or after 5 to 10 years. That's the practice today. What is true is in a family with a celiac, at the end of the day, the total amount of gluten used to be going down. Well, that would make it slightly more difficult to get a diagnosis. Probably in the next 5 to 10 years, we will be having more tests, different tests, but they are now in the research pipeline. And they are there because they are looking for answer to be able to diagnose people who are exposed to a low gluten load. Okay, from Jill, not all the children need to get a biopsy. Actually, we are completing the diagnosis in most of the celiac children now without the biopsy. How is the diagnosis done in children? We get a blood test. There is a value, what's called a cutoff. If the child presents an inflammation level, a TTG level, more than 10 times over this cutoff, we will repeat the test again. If this comes again a second time positive with anti-endomysian, they will not need the endoscopy. We will do the endoscopy when the values are not so high or the diagnosis is not clear, or when we need to get information because there are other symptoms. But now most of my patients get diagnosed with the blood test only. And why this? Because it's very difficult to access to a pediatric endoscopy in many countries in Europe. That's where the protocol was changed. Yeah, Catherine mentioned that was difficult for her to get diagnosed. Remember when we mentioned the patient journey, the step number one is to think about celiac. And that way awareness is so important. People who get a long-term anemia, long-term tiredness without explanation can be tested, and many of them will find their celiac. Emma is asking about being pregnant, so congratulations. The child will be tested as any other child, so there's no need to do any special action in that child. The baby will start gluten at the usual age. If the child presents symptoms, is when we will be testing. There's no routine screening during the first year of age. At the moment, there's no special recommendation about the calendar. Now, what is part of the working group on celiac disease, the EFSGAN, the Gastroenterology Society, and we are going to deliver soon new recommendation about the food introduction.
I'm going to just pop in here and ask you a few questions, Alfonso, just to keep the conversation going. So why do you think some GPs are reluctant to do any test for celiac disease?
Probably based as a matter of training. It's not only here in Ireland, it's happening in many countries. I remember I told when they were in the medical school, they were told the celiac disease, child with diarrhea, and a big tummy. So that image is still in the brain of many people. So if they get a proper training information, that changed completely the way they face patient. And I've seen lately GPs getting diagnosed people that were really, really early. So they really were thinking about that. They were having complaints of being tired for a long time without explanation. It's very common to have an iron deficiency that's not responding to the treatment.
Yeah, Sarah mentioned that this morning when she was on Pat Kenny with Anton Savage, that she sees a lot in her dietetics clinic, people with low iron deficiency, and that is usually a marker for it as well. I just noticed from one of the questions as well that somebody mentioned, has celiac disease any connection with low or no hydrochloric stomach acid? Is there a connection?
No, but what happens is your celiac, you have an inflammation, your acid production will change, and the same way that your microbiome is going to change. So that will be probably a secondary event.
Okay, I'm sure you see that other question there as well. My daughter is scheduled for a scope this June 8th. Her antibody TTG and her EMA was high positive number 12. Does this number mean 12 times the normal level?
Well, to give an answer, I will need to know the brand of the kits. So there are different kits.
Right.
So when one of the brand we are using, there will be a slightly positive. With other brand completely different, there will be a high level.
Okay.
So that's depend of the kits. So your lab had to be familiar, your doctor had to be familiar with the kits. That we say 10 times, and we don't say a number. Because
yeah, that's right. I remember you telling us that before in another webinar. And just out of interest, what is a normal TTG level?
So the normal TTG levels will be under in the brand we are using, for example, here in Kilkenny, will be less than 10.
Right.
So healthy people will have a low level of anti-TTG. The tranglutaminase is an enzyme that is all over your body, and it's actually the enzyme that repair and fix many of your tissue damage.
Right.
That's why you can get a false positive. For example, you have a very bad gastroenteritis and you are sick for several weeks, or you have a liver disease, or also have improved in some inflammation or rheumatology, and your enzyme is going to be working, can give you false positive of anti-TTG, and you may not be, at the end of the day, celiac.
That's really interesting. And I suppose just goes to show how difficult it is to diagnose at the end of the day.
Exactly. What happens with celiac disease is that every time we open the door, we find more doors.
Yeah.
I remember when the genetic came to the market, this is going to be the end of the biopsy and everything. No.
Yeah.
It was a polygenic thing. The TTG, when they came to the market, this is the end of anything. No.
Yeah, God, it's such a complicated. I remember Dr. Nick Kennedy also telling me at one point, like, there's 39 genes involved. Like, I mean, how do you turn off and on 39 genes? You know, it makes such a huge, it's such a complex disease, and it's that, I suppose, then feeds into my amazement that people don't test for it more common. It's not a more common test for it. I see a question here as well in the chat about gluten ataxia. What is gluten ataxia first?
Gluten ataxia is usually a child or an adult who cannot walk properly. It's to let you know how ataxia is. More or less, it's like being drunk.
Yeah.
So you're unstable, you don't have your balance, you cannot use your hand, you have tremor. It's very uncommon. And the problem is so uncommon that people almost never think about that. And to make the whole thing more difficult is many of the people with celiac or gluten ataxia do not express TTG antibodies. Well, actually, it's not true. What they have in the market is an antibodies against anti-TTG class 2, and they express antibodies against TTG class 6. So when we think about the gluten ataxia, we had to send a sample to one of the reference labs I have to be in a very good relation with the probably the best team in the world about gluten access, the team in Sheffield.
Okay.
And they give us a hand. That's the reason why we don't have a clear idea about the number of people with gluten ataxia, because they are not well recorded.
Okay, so it's not something that's common then.
It's probably more common than we think.
Okay, that's interesting. That's
And
interesting.
remember, these people usually most of them don't have gastrointestinal symptoms.
Oh,
So
right.
the person who's going to diagnose celiac disease is going to be the gastroenterologist. But as they don't have symptoms, they are not going there. They're going to the neurologist.
Yeah.
So if they are not trained and they don't think about gluten ataxia, it's going to be difficult to be diagnosed.
Absolutely. I see Jill has just mentioned again there that she's not sure about the brand. The bloods were taken in Drogheda General Hospital. GP seemed to think she could diagnose alone just based on the bloods, but the consultant is now referred for a scope. This brings me back to this whole a question I asked earlier on, Alfonso. The SBAN guidelines that came down from the European agency in the last couple of years were quite specific in stating that children, once they had 2 positive blood tests of a very high level, did not need a scope.
Exactly.
Scopes are traumatic at the best of times for adults, but for children, more traumatic, I would have thought. So is it unusual for a consultant to be sending a pediatric patient for a scope, given if they were able to diagnose on bloods now?
Well, if the levels are too high, actually there's no need for the scope. Only you need to see something else. For example, you think somebody may have a celiac disease, at the same time may have an inflammation of the esophagus, what we call esophagitis, and you're doing the scope because you want to see the esophagitis. The problem in Ireland, as far as I know, there's only 2 centers doing the scope for children.
Crumlin being one.
Dublin, and the second one is Kilkenny, and we only can do when they are older than 8. So there's a limitation about the access to that. Here we don't go for a scope if the levels are high. So only when the levels are lower and we don't know if you're actually a celiac or not, because the levels are not clear, then we go for a scope.
So Jill thankfully has followed up with a bit of more information. Her daughter's platelets were high. Sorry, other things coming in here, and her ferritin was low. So that's iron. Perhaps this is why they've referred her for the scope. And is it normal in a pediatric child?
May happen. So they may looking for inflammation, gastritis, or any other active problems.
Okay. I just going back up here in the chats now. Is there a link between pernicious anemia, B12 deficiency, and celiac?
Yeah, it can be related.
Yeah,
actually they are.
I could have answered that one for you. There you go.
Yes,
all sorted.
We have another one from Mary Claire. I think it's the last I see. Yes, liver
daughter
disease.
With Downs, diagnosed last year after many suffering. Doctors never thought of celiac, only tested for it after a false positive hepatitis blood test came up, and her liver enzymes were elevated too and was then tested. There is a clear link with celiac disease and people suffering from Downs, is there not?
Yes, there's a connection. Was part of the screening. It's slightly less frequent than what was thought in the past, but there's a connection. And also now, at least in peds, if we have any child with a high liver enzymes, one of the tests we have to do, apart of the classic of looking for hepatitis, is check if they're celiac or not. Because some people may present a celiac with a liver enzyme problem.
So I see here, Maury, just going back to answer the question that you put at the very beginning, and it really started off this great conversation we're having now. If you are on a gluten-free diet and you want to be tested, you do have to go back on the gluten diet for 6 weeks. I don't know, 6 weeks, is that too long, Alfonso? Would you need to go on it for that length of time?
Usually it's enough to get a positive. It's a positive. Okay. For example, in peds, you get a child who have a history of probably celiac disease, being off of gluten for a long time. Sometimes we negotiate with the family if we are going to do what's called a gluten challenge or not. So we do that on individual basis. So we are not exposing everybody to gluten. Depending on case by case, we make a decision. If you have been off of gluten for just a couple of weeks, then it's okay to go back.
Sorry, so that would be. I'm getting another call in here at the moment as I'm trying to close it down. So Maury, yes, unfortunately, you will have to go back on the gluten-free diet, and it will have to be for a certain length of time. And as an adult, if the bloods come back positive, you will then need to get the endoscopy done to be sure. Correct, yeah. Let me see if there are any other questions here. Let's see. Go back up to Emer. Emer's talking there about how she came through it through her neurologist and endocrinologist. Would that be something that endocrinologists would actually diagnose as well, celiac disease?
Well, they can be involved, yes. Sometimes there's a connection with diabetes. Well, the Emer say probably is because what they have told you. So the TTG we have in the clinical practice is the anti-TTG class 2. And for gluten induction, you need a class 6. That's not commercial. It's kind of experimental. So at the end, she got the biopsy, but it's the only way to diagnose that in some people.
And Emer, I'm going to plug our service here with Coeliac Society. Of course, if you need any help, don't hesitate to get in touch or to join, because don't forget, as members of the Coeliac Society, you actually get access to our very good dietitian, Sarah Keogh, and that's actually on the subsidised rate as well. So, and Sarah is fantastic. She helped me with my FODMAP diet and getting my own diagnosis as non-celiac gluten sensitive. So that was real support for me as well. I'm just going to see if there's anything else. Oh, here we go. God, Emer, you've been ahead of me. You've been ahead of me in relation to getting in touch with us and getting help from Sarah. And thank you I'm glad we were able to help out. If there's any other questions for Alfonso, now's the time to ask. The man looks like he has time this afternoon, which is unusual. Usually when I'm talking to him, he's in scrubs and has definitely just come from a clinic. Kathy has asked, why healing after diagnosis is extreme fatigue common?
Yes.
Yeah.
And there's a small group of patients, celiac, when they start the gluten-free diet, also when they are doing well, they have a change in the microbiome. So they produce a lot of gas and they continue with the malabsorption.
Mm-hmm.
So that can be the one that feel very tired, very bloated, and takes longer to recover. And they had to go sometime into a FODMAP diet or use antibiotics. There are selected cases. About a Helicobacter pylori, can be associated. It depends where you are. For example, in Italy, Spain, or Greece, in certain areas, up to 90% of the population is positive to Helicobacter pylori. So Helicobacter pylori is going to be linked to anything. On the other hand, people with Helicobacter pylori infection may have inflammation in the duodenum that can make difficult the diagnosis if you are not too high on the level you're on TTG. So it can be an overlap.
Okay. What about pins and needles? That's an interesting one. I haven't come across that before.
That may be a link to low vitamin levels because the malabsorption, your vitamin E levels go down. You may feel that.
Okay. Jill's daughter also has an itching her skin with no rash.
The rash, the full rash, what is called dermatitis herpetiformis, is not so common in the classical way. You can see cases, but not so common. But having a dry skin, or be prone to eczema is more common and maybe linked to the low levels of vitamin and the inflammation that happened at the very beginning.
Okay. Should Jill see a dietitian or a dermatologist?
I would go for both, but probably will get more impact with the dietitian. So something that I had to discuss when I go to meetings internationally is that how lucky we are here in Ireland that the dietitian are part of the clinical care. In so many countries where they're not part of the health system, get a proper support and the proper assessment is really, really difficult. Okay. And at the end of the day, this condition is something you treat with food, not with medicine.
Yes.
In the future, that may change, but now it's about food stuff.
Yeah, it is interesting. Sabina has a question. How common is it to develop type 1 diabetes in children with celiac?
That's a very good point. So both are connected and part of the same genetic area. So in theory, you should be seeing a lot of diabetic people in the cohort celiac, but it's not happening.
Okay.
It's not happening. So what's happening more is the opposite. People who get diagnosed with diabetes and they realize they are celiac at the same time.
Okay.
So it's not clear, but looks to be a kind of protective effect when you are celiac, you are on gluten-free diet, because they are not developing the diabetes that we are supposed to happen. Okay. Both are genetically connected, and it's thought that there are different presentations of something that can be quite similar at the very end.
Okay.
What
And
happened
just
in
for my own, remind me again, which type of diabetes can you actually cure yourself? Is it type 1 or type 2?
type 1 is diabetes that you cannot cure because all the cells are in the pancreas are destroyed.
Right.
Type 2 is linked to overweight, food habits.
And
So the
health,
one
yeah, okay.
exactly the one the way you can prevent. And actually, that's not completely true because 2 weeks ago came to the market a new medication to prevent type 1 diabetes,
Okay.
and it's going to be used in siblings of people with diabetes type 1, and the trials are almost finished. So, and hopefully we'll see that soon in the market. It will be an amazing thing. Just it's going to be changing the future of many people.
Great, fantastic news for people with that type of diabetes. Kathy has a really interesting question, and I think the answer for me as a lay person would be yes, there is a point in having her tested. So her 86-year-old mother has severe diverticulitis, diarrhea, and itching skin. Never tested for celiac. Any point in going to get tested or on gluten-free at this age? Well, the first thing, Kathy, is don't go gluten-free before you have the test. Have the test first. And obviously, I think if it was my mother at 86 and there was a high level of TTG, I would just then go on the gluten-free diet, because I think having an endoscopy at 86 is just too much. But that's not my medical opinion. I'm going to.
But that's why in the new guidelines, they introduce for adults the option to be diagnosed with celiac disease in the same way that children, for people who
Brilliant.
may, as that change happened in January 2023, because some people may have severe condition of not be able to face endoscopy.
Yeah.
So I think there's no harm to test. For example, what somebody with that condition gain. For example, they may feel stronger. Or I remember a case when we
at least more
diagnosed
comfortable, which is the most thing. That's the quality of life at this stage, I think, would be
exactly.
the thing I would be focusing on. I have two last questions now before we're going to wind up, because we're at 2 o'clock, and I know we had difficulties with Alfonso, but I do know he has clinics to go to. So Catherine says, I have osteoporosis and RCD1 since 2017. Can you give me what is the prognosis for this illness, and when will the new test be used in Ireland, such as the urine test? Many thanks.
The prognosis had to be established considering the full medical history. So only your doctor may go through that. So, and don't be afraid of asking questions. So sometimes
Alfonso's with me on this. You know your body better than he does.
Exactly. So I like to consider that when they're working with a family, it's kind of teamwork. I know about the medical background, but you know about the child. So we have to work together to make a better answer. About the test that you mentioned there, I presume would be the GIP, the gluten immunogenic peptides. Probably. So now you can get that online, but I don't know if they will be available in the pharmacies here in Ireland soon. They're starting to sell them all over the walls, and now they're very popular in the United States. They're using a lot, and mostly are they used by the patient himself.
But this is not this is not for testing for celiac.
No, this is to test the compliance of the diet.
Right, the compliance of the diet, exactly. And that Sarah's going to be doing a whole piece on that later in the week as well. And you can check out the schedule for that. Last question from Nicola, who's been diagnosed 23 years as celiac and only been to see a dietitian a couple of times. Should she have regular appointments with a dietitian? I would suggest, if you feel you need to, but if you're adhering to the diet, Nicola, and you're not having any symptoms, what do you think, Alfonso?
Well, I probably suggest to get, we published recently a paper. We realized the paper was about people with more than 2 years on gluten-free diet. So they were supposed to be experts. At the very beginning, we realized shockingly that 25% were having inflammation. So
yes, remember you telling me about this. Yeah.
What happened later, we started the trial. We saw if they were getting regular visits, let's say every 6 months, they trend was to improve. So they were doing that. They were getting reminders. So why? Because at the end of the day, you get distracted. They're not so motivated. I don't say you're going to go to the dietitian every month, but once a year, there's no harm.
Yeah, and again, just to tell you again about the benefits of being a member of the society. Your first celiac or your first dietetic appointment is at €75, and that's a subsidized rate. But then your follow-up appointments are €50. So, I mean, for your health and well-being, that's a €50 investment in yourself every year that you can be making for a sit down and a chat with our dietitian. And she'll do that online or in person. So I think that's a huge benefit of being a member of the society, is that you actually can have a meeting with a dietitian at a time of your choosing. So you're not waiting on the public sector, and you're taking pressure off the public system as well. Alfonso, it's 2 o'clock, and it's been great having the chats with you again. Thank you so much for your time this afternoon and for joining us for this, I think at this stage, it's our 53rd Coeliac Awareness Week at this stage. But thank you so much for your time. If you have any other questions or queries come in after this webinar, we'll send them on to you and try and get answers back to people. We'll post them up maybe on our Facebook page during the week. Thanks a million, Alfonso. You take care. Take care of yourself,
Thank you.
Lindsay
Thank you
Kelly,
for
and
having me
thanks a
here.
million to everybody involved
Bye-bye.
today. Take care. Bye-bye.